What if the best healthcare technology is the technology that gives a nurse more time to hold a patient's hand? At Ascension St. Vincent Evansville in Evansville, Indiana, Kimberly Lynn arrived expecting a routine electrocardiogram. Instead, she faced a medical emergency. Her nurse, Katie Schnotz, noticed Kimberly was frightened. Kimberly asked her to stay. Katie stayed. She held her hand. Kimberly later suffered a heart attack. More than a year later, the two reunited. Kimberly said she believed she might not be alive without Katie's help. Think about what she remembered, not the equipment, not the software, not the billing system. She remembered the person who stayed. That story should make healthcare leaders pause. We spend billions on automation, artificial intelligence, electronic health records, and revenue cycle technology. But perhaps we're asking the wrong question. Instead of, what can we automate? Ask, what human attention can we give back? That is especially relevant to medical billing. A denied claim often isn't a billing problem. It is the final symptom of an earlier problem with registration, eligibility, authorization, documentation, coding, or data. We keep fixing problems downstream instead of preventing them upstream. The best denial is the denial that never happens. Before buying another healthcare platform, ask one question. What work disappears? Not what features you add. What work disappears? That is the philosophy behind On Next. Technology should reduce repetitive work, identify problems earlier, and give physicians and staff more time to focus on patients. Because bad data plus artificial intelligence doesn't create better healthcare. It creates faster bad data. Start with 10 denied claims. Work backward. Where did each problem begin? Then ask your staff, what is the most ridiculous thing you have to do every week? Listen carefully. That is probably where your next operational improvement is hiding. And measure something beyond revenue. How many minutes did we return to patient care? Because healthcare efficiency isn't simply about doing more. Sometimes it is about giving a physician enough time to listen, a nurse enough time to notice, a patient enough time to feel heard. Kimberly Lynn remembered Katie Schnotz. Maybe that is the benchmark. Not how much technology we deploy, but how much human attention we protect. What administrative task in your practice makes you think there has to be a better way? Tell me in the comments. If this perspective resonates, share your experience and repost this for another physician or clinic owner who needs to see it. Build systems that remove work, protect the people delivering care, make more room for the moments patients actually remember.